Let's be real. Medication math can be a huge source of anxiety. But we're going to change that. In this explainer, we're going to build your confidence, turning that anxiety into a skill you can rely on, not just for your exams, but for your entire career. Okay, let's jump right in with a scenario you're definitely going to see. The physician's order comes in. Phenytoin, 0.2 grams, by mouth, twice a day. Pretty standard for a patient with a seizure disorder. So this order is our starting line. So you head over to the medication cart, you open the drawer, and here's what you find. Phenytoin, but it's in 100 milligram capsules. And right away, you should see the first little puzzle. The order is in grams, but what you have in your hand is in milligrams. This is super common, and it's our first step. So here's the big question, right? How many of these capsules are you going to give the patient? And I want you to remember, this is so much more than a math problem. This is a critical patient safety check. Getting this right, it's absolutely non-negotiable. Let's take a second to talk about why this skill is so incredibly important. You know, a mistake on a dosage calculation isn't like getting a question wrong on a pop quiz. It has very real and sometimes very serious consequences for your patient. Mastering this stuff is at the absolute core of being a safe and effective nurse. So, how do we solve our little puzzle? Well, first things first, we need to get our units speaking the same language. We have to convert that 0.2 grams from the order into milligrams. That gives us 200 milligrams. See? Now we're comparing apples to apples. Then we just divide the dose we want, that's our 200 milligrams, by the dose we have on hand, 100 milligrams per capsule. And boom, the answer is 2 capsules. Simple, right? But every single step is vital. Okay, so before we can really master all the cool formulas, we need to build our foundational toolkit. Think about it like this. You can't write a great essay until you know the vocabulary. And, in the world of medication, that vocabulary starts with understanding measurement systems and how to convert between them. In pretty much all of healthcare, the metric system is the universal language. And the best part about it is that it's a decimal system. Everything is based on units of 10. That's what makes converting between units so straightforward. So here's the deal. When you're going from a bigger unit, like a gram, down to a smaller unit, like a milligram, you're going to have a whole lot more of them, right? That means you multiply by 1,000, which is just a fancy way of saying you move the decimal point 3 places to the right. So, for example, 2 grams becomes 2,000 milligrams. Easy. And of course, it works the other way too. If you're going from a smaller unit, like milliliters, up to a bigger one, like a liter, you're going to have fewer of them, so you divide by 1,000. Or the easy way, just move that decimal point 3 places to the left. So 250 milliliters becomes 0.25 liters. If you can get this down, you've honestly mastered the hardest part. All right, you've got the basics of conversion down cold. Now let's build on that foundation. It's time to master the formulas you're going to be using every single day, both on the job and for your exams. This is where the magic happens. First up is a true classic, the ratio and proportion method. Now, it might sound a little intimidating, but I promise it's not. It's just a way of setting up 2 equal fractions to find one missing piece. The setup is, what you have on hand is to its vehicle, as what you desire to give is to the unknown amount. Let's work through an example. Say the order is for 4 milligrams of morphine, and what we have is a vial that says 10 milligrams per 1 milliliter. We set up our ratio. 10 milligrams is to 1 milliliter, as 4 milligrams is to our unknown, which we'll call X milliliters. Then you just multiply the 2 middle numbers and the 2 outer numbers. That gives you 10x equals 4. Do a tiny bit of algebra, and you get your answer. X equals 0.4 milliliters. Okay, another really powerful tool in your toolkit is what we call the standard formula. For a lot of people, this is a much more direct, straight-shot way to get to the answer. You'll often hear it called D over A times Q. That's simply the desired dose divided by the available dose you have multiplied by the quantity it comes in. So let's see it in action. The order is for 5,000 units of heparin. You look at the vial, and it says you have 7,500 units per ml. So what we desire is 5,000, what's available is 7,500, and the quantity is 1 ml. We just plug those numbers into the formula. 5,000 divided by 7,500, then multiply by 1. Your calculator will say 0.666 repeating, so we just round that to the nearest tenth, which gives us 0.7 ml. Done! Okay, let's level up. We're going to build on everything we've learned and tackle a topic you absolutely, positively must know for your exams: calculating IV flow rates. This is a huge focus area on the NCLEX, so let's nail it. And hey, don't just take my word for it. The source material couldn't be clearer. This isn't optional. It's not a nice to know. You will be required to do this. So let's get you ready right now.
This is it. This is the key formula you need to burn into your memory. To figure out the drops per minute, or GTT/minute, you take the total volume of the IV fluid in milliliters, you multiply that by the drop factor, which is on the tubing package, and you divide all of that by the total time for the infusion, and this is key, the time has to be in minutes.
Let's walk through a classic NCLEX-style problem. The order is for 1,000 milliliters of normal saline to infuse over 12 hours, and the IV tubing has a drop factor of 15. Now, what's the very first, most critical step? You've got to convert the time to minutes. That's the number one place people trip up. So 12 hours times 60 minutes an hour is 720 minutes. Now, we're ready to plug everything into our formula.
So you run the numbers. 1,000 times 15 divided by 720, and your calculator gives you 20.8. But wait, you can't actually give a patient 0.8 of a drop, can you? Of course not. So we have to round to the nearest whole number, which gives us 21.
But listen, the number 21 by itself is totally meaningless. 21 what? Bananas? The crucial final piece of the puzzle is the units, the correct flow rate, and the answer the NCLEX is looking for is 21 drops per minute. Always, always include your units. Okay, deep breath. The math is done. You've got your number. But I need you to understand that your job, your responsibility as a nurse, is not over. Not even close. Now we have to talk about the professional judgment that surrounds that calculation. The numbers are just a tool. The thinking is the real skill. And this is your final safety net. You must always, always, always run through the fundamental rights of medication administration. Is this the right client, the right medication, the right dose, which, hey, we just calculated. But you keep going, right route, right time, and so on. This is the critical thinking that makes sure the math you did actually translates into safe patient care.
And if you ever wonder where the buck stops, well, this quote says it all. It doesn't matter if the doctor wrote the order wrong or if the pharmacy made a mistake. If you are the nurse who gives the incorrect dose, you are legally responsible. That's the ultimate takeaway.
So, as you keep studying and as you move into your amazing career, just remember this. The formulas, the calculator, the math, they're all just tools. A nurse's most important, most vital instrument for keeping patients safe will always be your own clinical judgment.